Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week, we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now, here is the founder of LTI and your host, Dr. Jason Rountree.
Okay, welcome back to Laser Therapy Institute's podcast, your very own laser therapy podcast for providers specifically, and for those who want to have a little bit more technical knowledge about how laser works in the medical therapy realm. We're going to be joined by a special guest today, Dr. Scott Akridge from Tri-Cities, Washington. He's one of our expert LTI members. We're going to be talking specifically today about peripheral neuropathy. So before we get Dr. Akridge on here, just a few words about what exactly we're going to be really referencing the most. Obviously, you've got your central neuropathies that involve the brain and the spinal cord. You see those with multiple sclerosis, stroke, head injuries. We're not talking central neuropathies today. That's a topic for another day. We are going to be talking the peripheral neuropathies, specifically the sensory peripheral neuropathies, not so much on the motor or the autonomic neuropathies, although we might dip our toes into those waters also. But specifically, the peripheral neuropathies that we see patients coming in with burning, numbness, tingling in the hands, the feet, often due to diabetes, chemotherapy-induced, medication-induced, and a few other causes as well. So we'll get into that here. But Dr. Akridge, first of all, thanks very much for joining us today. Really appreciate it. Thanks for taking the time. And hello.
Thank you for having me on.
Absolutely. Always a pleasure to chat with you. Would you take a moment and just kind of talk to us a little bit about you? I know you're a chiropractor by trade there in Tri-Cities, and you've been doing laser for many, many years. But would you talk to me a little bit, tell us a little bit about your background and why you ended up moving into this laser therapy thing?
Well, my background is I graduated in 1980 from Palmer and got involved with a seminar series taught by a Dr. John Brimhall, and he introduced the class 3 lasers to our seminar group back in the early 90s, and it just fascinated me how you could treat tennis elbow or an ankle strain, or utilizing it for stimulating acupuncture, biomeridians, and so it fit well into the clinical model that we were practicing at the time, which was focused on patient wellness and more healthcare issues. And I came across an article about treating, post-surgical hip type problems with this class 4 laser. And it really piqued my interest because there's a lot of folks out there suffering with chronic knee problems, hip problems, shoulder problems, and just chronic pain in general, as far as your low back problems and things. And I was not aware in the state of Washington at that time you could even use a class 4 laser. And after contacting the doctor that put this information out, in fact, I called the Department of Health, and they were writing legislation to allow us to utilize the class 4 lasers. And once I knew it was going into legislation, I ordered a K laser that day, and knew that I wanted to go down that route of adding that to our clinic, because not only myself, but following in my dad's footsteps, he was a chiropractor. He always stressed, being on the kind of the cutting edge of treatment in your profession. And so it just fit well into our our model of where we wanted to go with helping patients. And from there, it's due to circumstances affecting my family, we decided to learn how to utilize the laser therapy for treating peripheral neuropathy.
So this is all the way back in the 90s. You know, I talked to hundreds of people, of course, between patients and then other doctors and providers, local doctors around me as well, that feel like laser's this brand new thing that just showed up and it's not proven well. But I mean, you're talking 30 years ago that we were talking about laser.
Well, actually, there's a device called a Tri-Light that was a 3 LED device that my dad kind of got bootlegged through Canada out of Germany at the time. And
No kidding.
I literally was suffering with an ankle injury that couldn't resolve. And I shined this silly light on it for about 25 minutes. And within a half an hour, the pain was gone, and it has not come back.
That's pretty amazing.
It really was.
Wow. Wow.
And that's how I got interested in the low level lasers, and then it was just a natural progression into the more powerful lasers, just for speed of treatment and depth of treatment, and I just can't. It's totally revolutionized how we practice.
Yeah, I got to say, for me, the same. I went from kind of a traditional chiropractic model plus some rehab to doing nothing but laser, really. We have some supporting therapies, but when you see it work, it's really, it's practice changing. It's life altering, really.
It is.
Yeah. If I can say real quick, just for those listening that haven't quite cued in on this yet, we're talking about class 4 versus class 3 and low intensity lasers. So your class 3 lasers also have been termed like cold lasers or soft lasers, low power lasers. Those are lasers that go up to about 0.5 watts. And then your class 4 lasers are anything above 0.5 watts. So from an older 5 watt therapy device all the way up to the military devices that operate at 100 kilowatts and so forth. We're talking about therapy units that, even though they're high intensity, they still don't do any cutting, burning damage to the tissues. And actually, dosage wise, between using low level lasers, the class 3 and then the class 4, the actual energy dosages aren't that different. You can just apply it much quicker, and then like you were saying, get that better penetration, because you're pushing more photons at that target. So you're going to get more photons to the proper depth of tissue to create that stimulus, that change, biochemical change there in the tissues. So so I know you do a lot with neuropathy now. Can you tell us a little bit about the patients that you see that you recommend get laser, as far as when somebody comes in with a diagnosis of neuropathy, or you diagnose them with neuropathy, what are you looking at there that makes you recommend laser as one part of their treatment?
Well, laser is, I look at it as an adjunct to what we do in the protocol. Laser is what's going to stimulate the healing of the tissue, the production of stem cell to help heal the tissue, increase circulation, reduction of pain, reduction of inflammation. It is a component, and it's a big component. But with our neuropathy patients, we also focus on causation, which I feel is driven by diet and lifestyle and other circumstances that lead to the symptoms that they present with. And if if they're not really dedicated to making those changes, we oftentimes don't accept them for treatment, because I don't want the laser to be a Band-Aid in this condition. You know,
So you don't want it to be a
in
temporary.
other conditions, right. In other conditions, say a rolled ankle, deep contusion, whiplash, those types of things, we're not looking at diet and lifestyle modifications, but in specifically with neuropathy, you have to look at what's driving it in the first place, and alleviate or make that a big component of the treatment as well.
Well, yeah, otherwise you're going to end up with that one step forward, two steps back approach, where the patient really doesn't progress. And I got to say, that is one of the things that drives me crazy as a clinician. If I see a patient that comes in and they do have peripheral neuropathy symptoms, but they don't know why, and they've been to their family doc and the neurologist, and they still don't know why they have neuropathy. Oh, they said it's idiopathic. They don't know why. Like, we should have an idea on what causes nerve damage in most cases, because it could still be going on. If you talk about a vitamin deficiency, I've got so many patients that have never been tested for vitamin D, vitamin B12. And it's a simple fix. They need to add in some vitamin B12 and vitamin D, and it should have been caught, but nobody ever even did the blood test to see. It's just labeled as idiopathic. So I think you're absolutely spot on, because if we don't really address the cause and it's still ongoing, these patients, even with something amazing like laser, just are not going to recover and stay better.
Right. They're not going to see the long-term results that you can get. And it's hard to believe that you can tell somebody that your body's is healing itself. You know, all the laser does is help the body. It provides the energy into the tissue to facilitate the changes, but ultimately their body is what's got to heal itself.
Well, yeah, and that's a good point, that patients do need to understand that their body is the one doing the work, and they have to kind of put in the effort there too to make sure that they're not setting themselves back. Yeah. Excellent. So, you know, I've coached, I don't know, several hundred doctors across the country now, and you and I have talked a lot. We see a lot of concern with other clinicians, other doctors, about how do I know laser is going to work, first of all, but then secondly, you know, how do I even start this in my practice? I don't even know where to start. So for those doctors, what kind of advice would you have for those who, for one, they want to know if this is actually going to work in their practice, and then two, how do they get going with a laser therapy practice?
Well, I'll steal your line that you told me, which is laser always works. It's how the patient's body reacts, you know, to the therapy itself. And I can't stress, I mean, like I said, I was doing laser therapy for close to 20 years before you and I met. And I had some really good mentors. But when you and I first got together, even before you started the Laser Therapy Institute, I came and job shadowed and did some internship in your clinic. It just took me to a whole nother level. I mean, I cannot tell you how much I appreciate having your knowledge base to call up as a resource when I hit a wall with a condition. And the training that LTI puts out for staff, because we've got 3 different technicians that are trained as much as I am on application of the laser therapy and the different conditions you can treat, that you wouldn't even know how to do it. You wouldn't know how to do it. It'd be all guesswork without having the modules that you've put out to teach us how to help these people with so many different conditions. I can't stress enough, if you want to become an expert and you want to be able to help people, you got to join Laser Therapy Institute.
Well, Thank you very much. That means
and that's
a lot.
totally unsolicited, by the way.
I was going to say, I'll check in the mail.
No, I feel that deeply about it, because I thought I knew my stuff, coming into your office. And by the time I got there, I knew I had a lot to learn.
Well,
your staff knew more than what I did.
I tell you what, I will brag about my staff. We have an incredible staff.
Yes, you do.
From the folks who are certified laser techs, through our other providers as well. And I think that's really critical, because you can have a doctor who's very knowledgeable and very dedicated to getting patients better. But if you have a staff who hasn't been trained or, hasn't gotten that same vision, success rates, even with good therapy, success rates tend to be fairly poor.
Yeah. Well, because you got patients that want questions answered, and your staff has to be trained, and you have to be trained in how to answer these questions. It's, it just gives the patient more confidence in their outcome if they know what you're doing.
Well, that's so true. And I think, between you and I, I know we see tens of thousands of patients every year for laser specifically, and for these conditions that are very difficult to treat. And we're coming down to the end of our time here today, but we're going to have you back again at some point to talk about some additional laser therapy topics. But I tell you what, if you want to learn how to use laser in your practice, we've got the tools, we've got the knowledge, we've got experts like Dr. Akridge on board with us, that we're able to all of us work together and use each other as a resource so that we can get our patients better faster, more completely, and get our success rates to as close to 100% as absolutely possible. Because for us, for Dr. Akridge, for me, for the rest of our LTI clients, it's all about the patient results. If you get those patient results, we don't really have to worry about new patients coming in the door and revenue and things like that, because we can focus on taking care of patients, getting those good results that we know we should. So, Doctor, thank you very much for taking time out of your busy day to join us today. And we'll be looking forward to talking with you again very soon.
Yeah, my pleasure. Have a great day.
Thanks. Bye-bye.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.